233,000 military personnel have been diagnosed with TBI since the year 2000, according to the Department of Defense. But there are treatments. Joining us now from New Orleans is Dr. Paul Harch, a physician specializing in hyperbaric medicine to treat brain trauma. And along with him, one of his patients, Chad Battles, who served in Iraq. Welcome to you both to CNN Saturday Morning. Doctor, let me start with you on this one. Can you remind our viewers what TBI is and how you have specifically treated it?
It's a mechanical injury to the brain that causes wounding. And hyperbaric oxygen is a treatment for wounds. And so based on what we had found, treating decompression sickness or the bends of the brain many years ago, we began to apply this to some Louisiana boxers and then people with other chronic brain injury. And starting in 2008, we began to treat veterans with residual effects of their traumatic brain injuries.
And Chad, if you could, just tell me briefly what caused your traumatic brain injury, and has this type of treatment helped you?
Yeah, my injury was caused in Baghdad by performing on a quick reaction force. I was a machine gunner, and just the everyday, the effects of the concussions and from every type of explosive you can imagine. And since I've been doing this therapy with Dr. Harch, I have noticed improvement in balance. A lot of the headaches I had been having are subsiding, and I've noticed an overall increase in how my body feels and quality of life.
Well, that's wonderful to hear. Doctor, what has your success rate been with this treatment?
More than 90% of the veterans that we have treated have experienced substantial improvement.
And this is all about getting more oxygen flowing through the body, right? That's what helps the brain?
It is, but it's more the intermittency of it. By exposing someone to this high pulse of oxygen for 1 hour, it acts like a signal to DNA of cells in damaged areas in the body, and in particular in the brain, wherever there is wounding. And the responsive genes are genes that code for growth and repair hormones. So in effect, what we end up doing is repairing the wounds in the brain that are due to the trauma.
And we understand, we've read this Swedish study that was published in the Public Library of Science Medicine, and it looked at a group of nearly 23,000 TBI victims, and it found that almost 9% committed acts of violence after diagnosis. Does that sound consistent with your findings?
Well, yes, although most of the veterans that I've treated have not committed acts of violence after that. In fact, I believe none of them have. But violence post-traumatic brain injury is a well-known sequelae. And one of the things that can exacerbate this or amplify the effects of the brain injury is exposure to altitude, and particularly Afghanistan. The elevations there, the traumatic brain injuries in our soldiers, we have felt may be a factor in potentially amplifying their brain injuries.
And certainly we just want to be clear, we don't know what happened here, but I'm curious, is it a change in the brain that makes someone more violent, or is it about a brain injury causing someone to not be able to control their impulses or know right from wrong?
I believe it's more the second. I think the general feeling is that due to the areas of the brain that are injured, there is a release or decrease of inhibition. So people don't have the control that they normally have.
And Chad, I know you're doing better with this treatment, but have you noticed any type of side effects from it?
There's been a slight side effect. For approximately a week, around my 30th treatment, I noticed an increase in agitation and just an overall feeling of frustration and just not feeling well. And that subsided, but one of the main problems that I've noticed in having this pre-treatment, post-treatment, is that with the TBI and including the PTSD, sometimes while I'm having an event or if I would be triggered, it's like driving a car with no brakes. You see the wall ahead of you, you want to stop, you push the brakes, but they're not working. So you know what's happening, but it's like you're just stuck in the reaction because your body's reacting and you're not able to say, whoa, let's stop this.